Hello, and today on Non-Meaning Podcast, we are with Professor ריצ'רד McNally from the Department of Psychology at Harvard University. Hello.
Hello, thanks for having me.
Thanks for being here. And I'd like you to introduce one of your studies, but first of all, on yourself a bit.
Okay, yeah, we one of the topics I think that got a lot of attention a few years ago was during a period called the Memory Wars in the United States and in the Netherlands and Australia and Canada. So there's a few countries that were affected by this problem. Essentially what this is all about is that there were people who were being told by their therapists that a lot of the signs and symptoms of depression or sexual dysfunction or eating disorders and so forth actually signified that they harbored repressed memories of childhood sexual abuse. And so the belief at the time, you had this idea of repressed or dissociated memories of trauma. This is something that Freud had talked about back in 1896, and the idea resurfaced again in the 1980s and 90s, where therapists were trying to help people recover memories of sexual abuse that they believe was the cause of a lot of their psychological symptoms. And many times what would happen is that they would be put under hypnosis, under these guided imagery, sorts of attempts to sort of unlock the memories of abuse in this belief that doing so would be in the service of reducing the psychological suffering. So they wanted to recover these memories of sexual abuse and then process them and put the memories to rest. Now, of course, all of this is based upon the idea that the mind protects itself by banishing memories of trauma that are too terrifying to have in conscious memory. But the memories are not really gone, right? So they're encoded, they're consolidated. These traumatic experiences are buried in their memory, but they can affect their behavior in adverse ways. So that was this belief in repressed memories of childhood sexual abuse. So the idea is that because the experience is so traumatic, the mind protects itself by blocking it away. Now, on the other hand, you had other folks who said, wait a minute, during a genuinely traumatic event that is very terrifying, when someone feels helpless, it's maybe a life-threatening event, combat, rape, earthquakes, these sorts of things are common ones, but perhaps childhood sexual abuse is also another. If that's the case, how could you ever forget it? Excuse me. That is to say, when a traumatic event occurs, you get this rush of hormones that occur that tend to consolidate and strengthen the memory of the trauma. This is what happens in post-traumatic stress disorder, or PTSD. The event is so terrifying that the memory becomes all too memorable. The problem is that people can't forget these sorts of things. That's what post-traumatic stress disorder is about. And so we had this strange situation where one group of therapists were saying, well, the mind is designed in such a way to protect itself. You could block out these terrible memories. And other people, a lot of other scientific types are saying, well, wait a second. If it's really terrifying and life-threatening and traumatic, the stress hormones should guarantee that the memory is never forgotten. I mean, the whole notion here, let's say in an evolutionary perspective, is that you want to remember traumatic events so you don't get in harm's way again. How can evolution create such a mechanism for blocking out things that you need to remember in order to survive?
So the popular science tells you either you can't forget or either you can't live because you're all the time experiencing the trauma.
We're experiencing the memories of the trauma.
Yeah, but
yes, right.
Basically that you can't live your good life, you can't just behave like nothing happened. Either you have a trauma and you forget it and you put a lot of energy forgetting it, or either you put a lot of energy trying not to remember it and you live the trauma all the time.
Well, yes.
This is the popular science agenda.
Yeah. I guess you could put it that way, right? Because certainly in post-traumatic stress disorder, the problem here is that the people remember the trauma all too well. In fact, they don't just merely remember it; they seem to re-experience it again. By that I mean it's not just simply the memory coming up that they can talk about and convey to another person, but they have the heart rate goes up and they start trembling, and so they're experiencing the physiological correlates of the real experience. And so that Well, actually, what we did a whole series of laboratory studies with individuals who either reported saying that I believe I have repressed memories of sexual abuse. That is to say that their therapists came to tell them the psychological difficulties with depression or insomnia or sexual problems or eating disorders or what have you. These are signs of repressed memories of trauma, but they didn't have any memories of trauma. So we called these the repressed memory group, just as a label. So these are people who believed they were sexually abused, but they couldn't get their memories yet. Then we had another group that reported having been sexually abused as a child, and then reported a long period of time during which they did not think about these things. The memories never came to mind. And then boom, something reminds them of it. And they say, oh my gosh, I totally forgot this. When my grandfather or uncle was touching me in certain ways and saying, this is how I show that I love you, and don't tell anybody else, and things like this. And of course, now some of the memories they were reporting were quite exotic. They said, they were involved in satanic abuse cults and all sorts of really crazy stuff. Then we had a third group of subjects that we studied, recruited from the Boston area, from the community. These were not our patients, although many had been in psychotherapy with others, who said, forgot my sexual abuse? What, are you kidding me? Of course I didn't forget this. I wish I could forget it. No, I've always remembered the things that were done to me as a child.
Those
I
are
can't forget
the
it.
classic offenders, not offenders. Those are
Victims.
Those are the classic victims of sexual.
Right. Yes.
abuse.
Right. That's right. These things happen, and I just I wish I could forget them, but I didn't. It's haunted me for years. And then we had a fourth group of subjects who were our comparison subjects. They said, no, I was never sexually abused as a child, thankfully.
Also classic group. Like classic group.
Yes. Oh, yeah.
I didn't experience it, or I did experience it.
Right.
So
that's right.
The two first groups were a group that you wanted to study.
Well, those, right, but we had to have comparison groups, right? We had to have a group that said, I've always remembered the sexual abuse. Another group says, I was never sexually abused. No, of course not, thankfully. So we did a whole string of cognitive psychology experiments in the laboratory, and we assessed them clinically as well. So to try to convey this as clearly as I can, there are certain methods in cognitive psychology that can test whether a person is especially good at forgetting things that they want to forget, right? And so if somebody did in fact have been sexually abused, and they happen to be very good at this talent, this skill, they're quite good at forgetting things, right? Then you might be able to detect that propensity, that tendency, that well-developed skill in forgetting in simple laboratory experiments, where, for example, they might see a list of words that are sort of neutral words, like table, chair, couch, fork, knife, or something, household objects. Or some of the words might be positive, like sunshine, laughter, joy, etc. Or they might be negative words, like abuse, perpetrator, terrified, hurt, etc. Right? Now, and so then you can say, well, if people are given certain words to remember and certain words to forget, would they be especially good at forgetting, when you test their memory later, all those negative words?
Because this muscle works so hard, so
right.
He can forget like that.
Boom. And so they might be good at forgetting, and especially good at forgetting the negative ones. Right? And so we did some experiments on that. So if in fact that this whole recovered memory phenomenon, is about people who can do that, and they do it quite well, then, there might be something to that. Our experiments showed that that was not the case. In fact, they had a harder time at forgetting those things. And then we have another group of types of experiments where you show people a whole list of words that are related. For example, it might be a candy, dessert, a cake, sugar, tasty, dessert. and then you have them later. You show these words and you ask the subjects, did you see that word before or not? Yes or no? Was it an old word that you saw before, or it's a word that you had not seen before? Then we also have distractor words that are kind of other words that were not shown. And so those words you would expect that they would say no to. But if they have this a propensity, to have false memories, we had words like the word sweet, for example, which is clearly related to the first list of words I mentioned. And if they might say, yes, I saw that word. Okay, so this is just testing a general tendency to have a false memory. So you can do these experiments like this. And what we found actually was that the people who had recovered the memories of childhood sexual abuse in one study, they had a greater tendency to say, yes, I saw sweet, when in fact they had not. And so in that sort of a case, you have sort of a false memory tendency. And so what we were able to do, these were just, I'm really oversimplifying the experiments. There's a whole series of both of those two lines of research that we were doing, testing about psychological mechanisms or psychological processes that might enable someone to forget certain bad things, or psychological mechanisms and processes that might enable people to have false memories of things that they didn't actually see or experience.
So those two groups, the people who forgot about the trauma and the people who remembered it, like specifically after many years, they were completely normal in forgetting and completely normal in remembering.
Well, they had a tendency to. They did show as a group, not everyone. They tended to show a tendency to have false memories in the lab, but they showed no greater skill at forgetting things, bad or good. And so we found no evidence of repression ability. We didn't find that at all, and we found some evidence of possible false memory tendencies. But what I think the most important conclusion that we had out of this whole research program is that the group that we call the recovered memory subjects, this group, really comprises two separate sets of people, very different. Okay, so remember that these are the people who said they reported that they were sexually abused as a child, usually around ages 5, 6, or 7. That was typical. And then it was a long period of time, as many as 20 years, when they said, I never thought about this. And then they remembered it again. Okay, that group. Now, there was certain people in that group that I think had genuine false memories of abuse. These are people who went to psychotherapy for a lot of different problems, and then they were in certain types of psychotherapy where they're asked to imagine, just think what it might have been like if your uncle had abused you, or things of that sort. And they would hypnotize them and things like that. And then later, these images would come up and they go, oh my God, that did happen after all. These, I think, are the false memory subjects.
It wasn't just imagination.
No, they didn't think it was imagination, right?
Yeah. Wow, it was real. It wasn't just close your eyes. No.
That's right. Not fantasy and not an image or imagery. Yeah. So you have people who have these things. So, but there was another set of subjects, and this is, I think, the most important finding, was that they had what I would call recovered memories, but there were not previously repressed memories. And they weren't even traumatic at the time it occurred. So these are, I think, the genuine cases. These are the ones I think that what they had, what they described. They described episodes of abuse, but they knew the perpetrator. It was somebody they had a good relationship with otherwise, an uncle, a grandfather, an older cousin, et cetera, et cetera. They were never scared. They were never traumatized. They were never physically harmed. It was usually fondling. Sometimes it was oral genital contact and things like this. And they had those experiences, but they were not traumatic in the sense of terrifying. They were confusing. They were sometimes anxiety-provoking, but the person would give them candy, would treat them in all these positive ways. And some of these subjects would what they were saying to them is that this was not like a rape or something that was terrifying. And so you wouldn't see the stress hormones being released. It was a confusing experience. They're clearly being sexually exploited, but it wasn't a trauma. And so then what happens is the perpetrator dies or the family moves or whatever, and they don't think about this for 20 years or so. And suddenly they're watching a made-for-television movie about incest or something like that. And all of a sudden, bam, these memories pop up about how they used to sit in their grandfather's lap and watch TV, and he would rub them in the crotch and things like that. And he goes, that's how I show that I love you. But shh, don't tell anybody else, because this is our special way of showing how I love. And the little kid goes, well, you know, why is he whispering? Is this bad? What is going on? You know, but then when they remembered they were not in therapy, right? So they would read or hear something about that, and then suddenly they remembered this. And what they did, they go, oh my God, that was my grandfather, that was my uncle. This is, you know, that was sexual abuse. I feel betrayed. I can't believe he did those things to me. And 1/3 of those subjects qualified for symptomatic post-traumatic stress disorder today. Why? Well, they didn't experience this stuff as a trauma when it first occurred. But then when they recalled it later in adulthood, they go, oh my God, I was molested. And now it was causing PTSD. So they saw it through the eyes of an adult.
Do you think that some of the people that tell psychologists to ask those questions or that write those articles in journals about incest, about things like that, want people to experience some trauma or to harm somebody else? Or why do so many psychologists and people are talking about those instances in families or
well, I think that happens. I mean, it's important. Yeah. In fact, I mean, I think that's a good thing that people are aware of that, because there are perpetrators out doing those sorts of things.
You were just saying that maybe some of the people didn't experience this stuff as trauma, and now after they read this article, psychology treatment, now they're experiencing a really big trauma in their life.
Oh, I see. Oh, I understand. I'm sorry, I misunderstood your question. Yeah, right. It's even though they didn't experience it as a trauma at the time, because they didn't understand what was going on, and they didn't experience the massive stress hormones, the feelings of terror, like a rape victim would, for example. You don't forget those things. They didn't experience it that way, but they were still molested. They're being preyed upon by this perpetrator. I mean, that's a crime. That's a crime. But they didn't experience it as a trauma until they remembered it and then interpreted it correctly through the eyes of an adult. You know, and so I think that these cases, I think sometimes these are some of the cases that people did see clinically. But what they would do, but then the therapist would say, oh my God, because the person, when they see them, they're walking in there telling this, and they got all these nightmares and PTSD symptoms. But some of the therapists misinterpreted. They didn't understand. They said, oh my God, this was so traumatic as the kid repressed it, kept it away, and now finally, when they're an adult, they remembered it, et cetera, et cetera. But I think they have it backwards. The reason why they forgot it, or that is to say, the reason why they didn't think about it for many years, is that they didn't understand it. It was not experienced as a trauma. There were not the stress hormones that would make the memory vivid and recurrent as in PTSD. But later, when they did remember it, they realized that they've been betrayed and molested. Yeah, and now they're distressing.
I'm just asking myself, what's the goal of psychology?
What's not a goal?
I'm asking myself, what is the goal of a psychological treatment, whether to pursue justice or whether to make someone's life happier?
Mm-hmm. Okay,
if you want to pursue justice, try to vivid those memories or try to but try to make someone pursuit of criminal justice system or stuff like that. But if you want to make his life happier, maybe don't touch the subject, because it's not a trauma. It's not the cause of what's harming or what's disturbing his day-to-day life.
היי, רציתי לספר לכם על המשמעות. על המשמעות זה פודקאסט שמעבר ל2 מיליון האזנות בחודש, שכמובן משפיעות על דעת הקהל ועל השיח הציבורי, עושה הרבה יותר מאשר ראיונות מיושבים בטמפרטורת החדר. אנחנו מזמינים סקרים שנועדו להשפיע על דעת הקהל ולשקף את דעת הקהל האמיתית. אנחנו יוצאים לשטח, להפגנות האלה של קפלן, בשביל לדבר איתם ולנסות להוכיח להם שמה שהם חושבים הוא טעות מוחלטת, והם אפילו בעצמם לא מסכימים עם המסר שיוצא להם מהפה. אנחנו עוזרים לאנשים להוציא רישיונות נשק, ואנחנו מסקרים אירועים תקשורתיים, בעיקר של הימין, שמדברים על הכרעה, כמו מעל ההכרעה שיצאנו אליו, ואנחנו נותנים לדבר הזה הדהוד ונוכחות ציבורית. אם כל זה מעניין אתכם, תתמכו בשקל ביום, תתמכו ביותר, העיקר תתמכו, כי לנו אין את הקרן החדשה, ובלעדיכם כל הפרויקטים הנפלאים האלה פשוט לא יכולים לעבוד. הלינק נמצא בתיאור הפרק, ומוכר כמאסר כספים על ידי כמה רבנים ששאלתי אותם, וגם יש לכם סעיף 46 שמאפשר לכם לקבל 35% מכספי התרומה בחזרה ממדינת ישראל היקרה שלנו.
Yeah, I think I understand your question. The key thing here is that asking questions such as when you're just doing a general history, taking a history of the patient, back when you were younger, did anyone who is at least, say, 5 years or older than you were ever touch you or do anything sexual to you that made you feel uncomfortable? That's just a general question, right? And most patients would say, no, I don't know. I don't think so. Okay, then move on. Asking a question about previous experiences is perfectly fine. That's normal. And if the person says no, then you move on to the next question. Have you ever had panic attacks or whatever you're assessing for? You're going through asking just getting history. Where did you go to school? You'd ask about did you have any other bad experiences that were very frightening, et cetera, et cetera. But you're not probing them, right? You're not being, seeking social justice by trying to excavate memories and pushing the person, although there's some of the people in the community, we're doing that with our research subjects who came to our lab to participate in these studies. But asking a person whether they had such experience as a child, that's perfectly fine. That's fine. That's just normal assessment.
Do you think that there is a political agenda behind psychological treatments or maybe modern psychological agendas in your field that made you research this subject of sexual abuse?
Oh, the reason why I was doing it is that we had no research on the actual people who are reporting these things. We had people like Beth Loftus at the University of California, one of the greatest cognitive psychologists ever, actually. She had done all kinds of research on memory fallibilities, about perpetrator misidentification, all kinds of different things like this, and a real giant in that field. But she wasn't, and her memory is related to trauma, but she wasn't doing research on people who believe they actually have repressed or recovered these memories. We're actually doing it on those folks. Then you had a lot of the people on the other side who were, some of them were, interpreting all kinds of physical symptoms as possible signs of repressed memories of childhood sexual abuse, operating on the assumption that those are actual indications of these repressed memories and their psychological difficulties can be improved, that you actually would improve the happiness and the health of these people if you could unlock those memories and process them and work through them and then sort of settle this and then recover. So I think the intention was good. I think they're I don't question that they're politically motivated or anything like that, but they were simply trying to help people who are suffering from a wide range of problems, which they believed, and I think mistakenly believed, originate in memories of sexual abuse that were repressed.
What I'm trying to find out is if your perspective is not your perspective, if your perspective as a human being, that most of the things that harm your day-to-day life, your בריאות, your clinical health, on day-to-day, on your mental health, is caused by trauma, sexual or not sexual. So as a parent, you would try to over protect your kid from a trauma. Don't be with this uncle alone. Don't go there. Don't go in the street. Don't do anything. I want to protect you, and this will be the best thing for you as an adult. And if so, we can't really raise many children. Maybe one, maybe two. Did we notice like everything about our children? Did we protect him enough? This is like the agenda of Jonathan Haidt,
Right.
who says, don't overprotect them. It does them more harm than good.
Mm-hmm. Yeah, right. Well, actually, there is some research relevant to John Haidt's suggestion. You know, he wrote the book The Coddling of the American Mind, of course, with Greg Lukianoff.
The Anxious Generation.
What's that?
The Anxious Generation.
Oh, the Anxious, that also too. Right, yes, right, that's right. Well, both of those, right. We have actually some studies that suggest that having challenging experiences as a child that you then master versus being protected from having challenging experiences at all actually is quite good, if that makes sense. You know, so it's not that being exposed to stressful. Let me rephrase that. Protecting the kids from having any sort of stressful experiences in life is well intentioned, but John's concern, I think there's some merit to that, because when kids have normal experiences that are stressful, the ups and downs of everyday life as a kid, and they master those, that gives them confidence. And there's some research that shows that. That's not work I did. This is work that has been done recently on kids. So kids who encounter certain challenges, I'm not going to say traumatic stressors, because the traumatic stressors aren't good. I mean, but the ordinary stressors, if you will, from childhood, and master them and do okay. That's a good, a good thing.
What I mean is that maybe your study, if we combine it with the Jonathan Haidt study, we can come to the conclusion that if we focus too much on traumas, we might cause blaming those traumas for our poor mental health on being adult. And if we say, you have some something that bothers you as an adult, let's solve it out. Maybe the trauma is not the cause. And maybe you also can invent traumas. You can a false memorize those traumas. Maybe this is something reasonable to say that we should, in psychology, we should focus maybe also on traumas, but also on other things that might be the cure for your mental health.
Yeah, okay, yeah. I'm a cognitive behavior therapist. That's the tradition which I'm trained. So it's quite different from the psychoanalytic or psychodynamic perspective. But what the cognitive behavior therapist is always, they make a distinction between two different things. One are initiating variables. These are the sort of original causes, et cetera, et cetera. And then the maintaining variables, right? And so the real challenge is to deal with the present. What are the factors, the variables, the factors, the circumstances, the lack of skills or things that you need to do in the here and now that is maintaining the problems you have today? So an example, I'll just give you an example that sort of illustrates this. Suppose you have someone, a teenage boy, who is quite socially anxious. And so he starts drinking alcohol because it makes him feel a little more comfortable in social situations, right? And so as he gets older, his social anxiety wanes. It just goes down. He may not necessarily have been treated, but he feels better. But he's been drinking heavily all along. And now he's now in his mid-20s, and he is drinking no longer to treat his social anxiety, because he's no longer socially anxious. He now continues to drink to prevent a withdrawal syndrome. Or so he's got habits and withdrawal. So that's the maintaining variables. You say, well, we have to address the original deep causes in the past, his social anxiety,
exactly.
Right? So if you want to treat this guy's alcoholism, you got to go into his past, and that's over. He's no longer socially anxious. You can't treat someone for social phobia who has no social phobia. That's what got him going. But the maintaining variables are the only ones we can deal with, the here and now. And so you're dealing with, doing various treatments for alcoholism and things of that sort, not treatments for social phobia. That's the only thing you can do. So it's the maintaining variables. I think that's what you might be driving.
Actually, it's a great example.
Yeah.
Thanks for being my host at On Meaning, ריצ'רד McNally, Professor ריצ'רד McNally from Harvard University. Thank you.
Thank you for having me.